Thank you. We are going to move on to our question and answer session. Yeah. Do you want the speakers up here or?
Okay, we have a question for Dr. Fabisiak. Which hospital system was used to derive the data for the asthma and birth outcome studies? And how many more health systems are utilized by the communities? Related to that, do you think excluding other hospital systems may have influenced the data of the studies?
So we use the records from the UPMC health system, and I certainly acknowledge the fact that there are other health systems that are available. It's just that type of patient-based data certainly can be gotten, but it takes a little bit more effort to get the appropriate IRBs to protect patient confidentiality, et cetera, et cetera. And in response to your question, I mean, it is possible that it influenced the data, but I think it's pretty strong as it is that there is an effect on asthma exacerbation. I mean, 4 to 5-fold increase in risk of asthma exacerbation is certainly significant and worth taking note of. Would that number have been different if we had included more people? I certainly hope not. I don't think it would have gotten less. If it had gotten bigger, then I think we would have an even bigger problem. But I just can't imagine that that would be the case. I mean, the fact is that that level of sample size was enough to show a potential effect.
Okay, thank you. Question around fracking waste. Was fracking waste examined as part of the studies? And if not, why? What will future studies, will there be future studies that look at fracking waste?
So in terms of, does this work? Is it working? Okay. So in terms of fracking waste, we actually did look at location relative to places that accept fracking waste, but both liquid and solid. We tried to get numbers that were useful in terms of amount of waste accepted, and we really found that there were no good reliable databases that would allow us to sort of say, there was X amount of waste at this particular facility, this amount of waste at another facility. But if we just looked at location to these places that accept fracking waste, we did not find any relationship to any of the health effects that we looked at.
Thank you. Question on community input and participation in the studies. Did any of the studies involve ongoing community input in the research process beyond initially advocating that the studies be done?
We did enlist the help of something that we called a community advisory board, which we were sort of in contact with about 4 or 5 meetings at the beginning of the study to sort of get community input. To be fair, though, that was really sort of done after the studies were basically designed, really in collaboration between us and the State Department of Health. But we certainly enlisted the help of those people early on so that there'd be some level of transparency.
A couple questions around the buffers set in the studies. Why were the study buffers set at 10 miles for asthma but less for other studies? And if you could mentioned that how the studies address multiple wells overlapping within a 10-mile radius and what effect the cumulative emissions of those had within the context of the buffers.
Sure. So if you remember, there's a couple of questions in there. If you remember the slide I showed with the asthma results, so that there were different distances, and there were, within each distance, there was a term for low, medium, and high intensity. So that low, medium, and high intensity is really a function of the number of wells that were in that buffered zone, the distance, obviously with a well being closer to a home, being weighted more and counting more towards the overall exposure. So in many ways, we did indeed include a sort of dose response, so to speak, in that. In terms of the different buffer distances, both the adverse birth outcome and the asthma study essentially took very similar approaches, with the sort of 0 to 10 mile being the exposed zone and then different buffers within there. Because of the few number of cancer patients, we essentially used smaller buffer distances to sort of keep the statistics under control, because we're able to sort of deal with those smaller numbers better that way.
Lots of questions coming in for you, Dr. Fabisiak, on the studies. Question, what is it about the production phase of gas extraction that leads to higher asthma exacerbations? What might the pathway of human exposure be?
Well, I certainly don't know the answer to that question. I guess I could speculate to some extent. First off, it's the, if you remember from the sort of slide, it's the longest phase. So a well is in its production phase the longest, as opposed to being fracked or being drilled. It's also the point in time when flaring is most likely occurring, when the gas is is coming back up to the surface and needs to be controlled at times. So flaring is an activity that is probably specific for that production phase. But again, I don't know that that's the reason, but that's certainly something that could contribute.
If I can add something, there's some studies, a lot of studies now being done about methane release. And from the point of view of the questions we're asking, though, probably what's the most important finding is the enormous variability from site to site, including 2 sites next to each other, drilled by the same companies, which will just produce so much more than another one, and time to time for the same site, because there's technical term, but I call it a burp. There's this sudden outflow that needs to be controlled, where a lot of methane comes out. Well, if the methane's coming out, so is everything else that we're concerned about. So it's irregular and difficult to control unless somehow or other the regs get changed, so the industry is forced to tell us all about these.
Another question on the studies. How different, if at all, would the childhood cancer ORs look if you relaxed your p-value cutoffs to 0.1?
Can you repeat that question? I didn't hear it well.
How different, if at all, would the childhood cancer ORS look if you relaxed your p-value cutoffs to 0.1?
I guess I wouldn't know unless I did that.
Okay, thanks. Are you aware of any studies on PM 2.5 from the amounts of diesel trucks located, driving, parking, and running engines at well pads?
There certainly have been studies done. I mean, diesel exhaust is one of the biggest contributors to PM 2.5 in almost any situation. And in any urban environment, a lot of it comes from diesel exhaust as well. So I know that there have been measurements done near sites that have shown increases in PM 2.5. It's a little difficult to really determine whether or not those numbers consistently surpass a health-based standard, but they would certainly be contributing to some amount of PM 2.5 level of pollution. Using our satellite data, we've attempted to sort of look at that a little bit to see if there is an oil and gas contribution, and we haven't been able to really see a specific contribution of oil and gas development to the ambient levels of PM 2.5 that are measured that way. But that doesn't mean that local levels couldn't be impacted.
A question for Kristen. Will DOH contact PEMA and FEMA to have them include compressor stations, pigs, and processing plants into the state's hazard mitigation plans so communities can manage harm that comes from living near them?
Yeah, so I think that's a really important question. So we do have our Bureau of Emergency Health Preparedness in the Department of Health, and they work very closely with PEMA and DEP, and we are actively reaching out to those folks to talk about how we ensure that county emergency management plans include the industry and any potential impacts in terms of evacuation or things like that that residents would need to know about. So those conversations are going to be starting, and we thank residents for bringing that to our attention.
Thank you. Another question on the studies for Dr. Fabisiak. The data from the midstream facilities, where did that, such as compressor stations, where did that data come from?
The compressor stations and other things, they come from a variety of sources. The compressor stations their location can be found through the Pennsylvania emission inventory, which lists all of facilities, not only in oil and gas, but that are emitting any type of air pollutant, so we know where they are. Toxic release inventories can be found by probing the toxic release inventory database from the EPA. Same with Superfund legacy sites. So all of these sites can be located through a variety of different publicly available databases.
Great, thank you. We have another question that I think could probably apply to all three of you, but anyone's welcome to answer, and that is that there's something about fracking that increases the risks of poor health outcomes related to fracking, and we know that the closer you live, the higher the risk. And so the question is, do we need to know the exact chemicals that are causing people to get sick to better regulate the industry?
Once you use the word exact, the answer is no. There are a few things that we can say. If you just start with what I mentioned before, with the three mixtures that you've got, and you assume that those three mixtures spend some time deep below the earth, it's very warm there. So you've got hot stuff, and if you've ever been in chemistry class and you put a beaker of something with a Bunsen burner below it and you put a couple of chemicals in there, you make mixtures that way. So you're starting with all these chemicals, and it's very hot underground, and you're adding all this water, which is now heating up, and we know the major chemicals that are coming up, that are flowing back, that are now stored at levels that we can be exposed at ground level, but we don't know all the fine chemistry.
Okay, another question on the studies. Is the proportion of bone cancers being Ewing type typical? And for a given number of bone cancers, is Ewing's notably worse?
So if I'm understanding your question correctly, the studies were not designed to essentially determine whether the overall number of Ewing sarcoma or any of these cancers were elevated compared to other areas. It was basically designed primarily to find if any of those were associated in proximity to any of the environmental sources that we looked at. So it's not a question of saying there's a cancer cluster or not. It's just a matter of saying that Ewing's was or wasn't associated with living near a well or living near a compressor station.
Great. Another question. How do the childhood cancer odds ratios compare with the two other case control studies on this, McKenzie and Clark?
The only other study that I can think of that comes fairly close of recent times is a study out of Yale that looked at leukemia and proximity to natural gas wells. We did not see an association with leukemia, but we did see an association with lymphoma, and I think it's probably relevant that both of these cancers are indeed cancers of the bone marrow and the white blood cells, so they are sort of related to each other pathologically. There were some other technical differences between those studies that may account for the difference as to why they saw something with leukemia and we did not. They actually really only focused on one particular subtype of leukemia, so that could account for the difference.
A couple questions related to, I guess, the definitions of the phases, drilling and production. Was the data on the drilling phase recorded, and do the studies show that there are not health impacts during the drilling phase? And then, why the focus on the production phase and what information was found in the other phases?
Okay. So if I'm, we were able to sort of address the different production phases because there are certain events that are certainly listed in the database for all of the wells, like when the well was drilled, when fracking began, et cetera. Granted that there are gaps in some of that data, and we make an attempt to essentially, when there are missing data, we essentially fill that data in with what we know about the average of the duration of each of those particular well stages. I don't know if that completely answers your question, and I didn't hear it completely either, but does that help? Okay. Done?
All right. Thank you. And thank you, Dr. Goldstein, Dr. Fabisiak, and Kristen Rodack for being with us today.